Hello, I'm Grant Foley here at the Midwest Center for Joint Replacement. Today we're going to be stepping you through your exercises that you'll need to be doing following your hip surgery. So there's no new exercises that you're learning now that you didn't learn in your preoperative set. And if you have any questions, please feel free to reach out to our team. Again, we've got a great group of people that are more than happy to answer any questions that you have at this point. Thank you. Hey, it's just going to be good to understand you're going to be doing these exercises on your bed. Not everybody's going to have a table. Sometimes the bed's too soft, but that's probably the best you can do. The floor is going to be a little tricky to get up and off of with a painful hip or knee. And also want to make sure to remind you guys to do these exercises on both legs. And it's going to be really helpful to have both sides as strong as possible to recover from your surgery. We're doing the quadricep set. Tighten that muscle on the top of the thigh. This is review. You guys have done this one in your preoperative set. Hold 5 seconds, relax. You can do 10 repetitions on both sides. You can do this at the same time on both legs. Hold 5 seconds, relax, 3 times a day. And for circulation during this recovery stage, so again, you can do both legs at the same time. Pull the foot back, hold 5 seconds. Point it down, same thing, hold 5 seconds. 10 repetitions, you're going to be doing this one 5 times a day, so pretty frequently. All right, so we're going to do the glute set, and again, Ellen's just going to squeeze those rear end muscles, hold for a good 10 seconds. Just a good medium squeeze, you don't need to squeeze as hard as you can, relax. 10 repetitions, you're going to be doing those 5 times a day, okay? Just a simple exercise, squeezing exercise to facilitate circulation during your recovery stage. Okay, we're going to go to the heel prop and knee extension with the towel. You know, I would say you want this towel to be big enough to where it kind of keeps the rest of your leg up off the bed. So again, this is just gravity assisted. You're not actively doing anything. You're just positioning your leg this way, so the weight of your leg just kind of forces the knee and the hip down straight to flatten out. Okay, so you can always take a little bit of pressure off of it by scooting it up slightly. You make it more aggressive by scooting it out further towards the heel, so more of the leg's pushing. Okay, so you're holding 3 minutes. If 3 minutes gets to the point where that's doable in kind of the medium pain range, then you're trying to increase your time to 5 minutes, 5 times a day. All right, so we're going to do the heel slide. Ellen's just going to slide her foot along the bed. Feel a little stiffness or tightness in that hip, you're going to hold 5 seconds, let it come back down. You're going to do 10 repetitions 3 times a day. And again, you can expect a little mid-level discomfort, 4 to 5 out of 10 tight pain in the hip as you're doing that one. That one's going to be a little bit difficult. So that's heel slide. All right, so we're going to talk about walking just for a second here. It's super important to get off on the right foot when we talk about your gait or your walking pattern. We do not want to walk with a stiff leg. You don't want to walk with a flat foot. You want to make sure that you pick that foot up almost like you're over-exaggerating, kind of stepping over top of something. So what we're going to do, Ellen's going to move the walker forward. Let's say she's had her left leg operated on. She's going to really pick that foot up, put the heel down first, good, and then step forward with the other leg. Good. Okay, so the walker goes forward, really over-exaggerate picking that foot up. The leg's not stiff. Good. Pick it up, put the heel down first. Good. Normally you walk with a heel to toe pattern. You don't walk with a foot flat pattern. So we really try to exaggerate and emphasize kind of put the heel down first and you push off on the toe. All right, so now we're just going to teach you how to sit down and get out of the chair safely. So Ellen's just going to back herself up to where her legs are touching the chair. The leg that she had operated on, she's just going to scoot it forward slightly, reach back for the chair, and then sit down slowly. Good. All right, so now we're just going to talk about standing up. Okay, so you're going to scoot to the edge of the chair. Let's scoot the operated leg forward a little bit. Good. You're going to keep the hands on the chair. You're going to drive yourself up with your arms and your unaffected leg, and then you can reach for the walker. We're going to talk about stairs and how to safely go up and down. And at this point, this is just going to probably replicate kind of a curve, but you'll grasp the concept here. Okay, so when you're going up the stairs, you're going to lead with the good leg or the unaffected leg. So Ellen's just going to hang on. Say we've had the left leg operated on, the hip or the knee. She's going to lead then with the right leg going up the stairs. So again, up with the good. Good, come all the way up. So that's how you go up safely. Lead with the good leg. All right, so now we're talking about coming down the stairs. So again, we said the left leg is the leg that we have an operation on, okay, the hip or the knee. So that's the leg that we're going to lead first with, okay? So you go up with the good and down with the bad, okay? So the left leg goes down first, and then the right leg comes down next, or the unaffected leg. All right, so we're adding in a few exercises. You're getting to weeks 3 and 4. So we had a real simple set, probably the first 2 weeks that we were working on. So we're mixing up some, giving you a couple that are a little bit more challenging. So Ellen's just going to sit on the edge of her bed. You could do this in the chair. The picture shows the chair, but since we're here on the table, you'll see the concept. So we're just going to straighten that leg out, pick up the foot, hold that just for a second, come down slowly. You're going to do a set of 10, 2 sets of 10 on both sides, 2 times a day. So we got 2 standing exercises that we're adding in now too, okay? So we're first going to do the hip abduction exercise. Just using the chair for balance, you're not leaning on it. We're just going to lift that leg to the side. Don't lean the other way. Pause for a second, come back down, smooth, slow, controlled motion. You're going to do a set of 10, rest, 2 sets of 10 on both sides. Very good. And then we're also going to do the heel raise, where Ellen's just going to lift up onto her toes. Pause for a second, come back down. Same thing, 2 sets of 10. Rest after the first set. The chair's just there for balance. All right, so we're talking about the straight leg raise. We want to make sure that after the hip operation, we monitor pain levels, okay? So we don't want anything going beyond a 4 to 5 out of 10 pain range. It can just be more irritating than helpful. We've got other exercises that we can work on, so you can revisit it every few days just to see if that pain level has changed, but we don't want to go beyond that 5 out of 10. So you tighten up the muscle here, pull the foot back towards you. You're going to lift about a foot up off the bed, pause for a second, come back down. You want to control that, smooth controlled motion, 10 repetitions, 2 times a day, each leg. We just wanted to mention something about managing your activity is challenging during this stage. And for the most part, especially weeks 0 to 2, you're just in recovery mode where your activity levels is pretty minimal. It's just necessary trips, activity in the house, to the restroom, getting a bite to eat or something to drink in the kitchen. Car trips at this point don't tend to go very well. So other than just trips to the doctor, we have a lot of people that try to go out and tinker around the garage and roam around the yard. So the amount of time that you spend up on your feet is directly related to that pain and swelling level. So really that first couple of weeks, only the necessary level of activity in and around the house. The threshold for those tissues in the area where you've had your surgery is still just very low. So it just doesn't take much activity to irritate that beyond the point it's already going to be uncomfortable anyway. So if your pain levels in the evening, swelling levels in the evening, and at nighttime it's tricky to sleep anyway, are starting to climb, you may just monitor your activity level to make sure that you're not exceeding that. So, in weeks 3 and 4 that can bump up a little bit more, but still car rides aren't good, trips out to eat where you're seated for a long period of time, the seated position, again, the car, it's just not a fun place to be after you've had your operation for the first few weeks. So folks that are super motivated, we understand that they're wanting to get moving, but at the same time, you really have to just manage your activity. Do your exercises, be consistent with your exercises, but for the most part, the running around activity needs to be pretty minimal to make sure that you're not exceeding those thresholds.